Hello, my name is Andrew Kanegi, and I'm really excited to be able to bring you some hopefully helpful information on mental health for those of you who are pursuing some work in biblical counseling. I certainly wish I could have been present with you in the course. Here I am in my own home, as many of us are learning to do in terms of our interactions and teaching during our uh, global pandemic. And thankfully, the need for helping people is very much still present. And so I hope that there are some things as I share that will inform what you're doing so well in bringing Christ to your community. A little bit about me. I am a Christian. I grew up actually going to Salem Heights, and I'm very grateful for all that I learned from that. I've continued to be involved, primarily living in Salem and in a few different churches over the course of my life. I'm also a clinical psychologist, and I graduated from George Fox, their Doctor of Psychology program, and I currently work at Mid Valley Counseling Center as an independent practitioner. How did I get here? As a Christian, one who loves Jesus, who believes the Bible, and is practicing as a psychologist. Well, primarily that came through my work in missionary endeavors after college and my involvement in youth ministry. In both of those endeavors, I was really put face to face with real struggles and difficulties in people's lives and real suffering and pain. And of course, as believers, we want to bring Christ into those situations and see folks transformed. And I got to be part of doing that in many respects, but I also came across all kinds of situations with families, with youth, where I wanted to know more what I could do to help. I wanted to understand these sorts of interactions and experiences people were having that I didn't understand. And as I learned and looked into kind of what might inform the work that I was doing, psychology became an interest. And here I am, quite a few years later, as a psychologist. And I'm grateful for that. For me, those have worked together well. And I hope to share with you a little bit in terms of how I've been able to arrive at that. And hopefully that might answer some things in your own thinking about that. What I do currently, I work for Mid Valley Counseling Center, and I provide primarily psychotherapy or counseling for folks of all ages and assessment. I specialize with children and adolescents, so I work with all ages and tend to focus what I do on treating depression, anxiety, and ADHD, though I see all kinds of things. Also provide psychological assessment in terms of assessing things like ADHD, learning disorders, trying to get diagnostic clarification, and I'm moving into some forensic assessments as well. And certainly an emphasis of my work is being able to provide a faith-integrated therapy for those who are requesting that. And for those who don't, being able to hold for myself as a Christian what that means for me to embody Christ in the therapy room. I want to talk a little bit first about the integration of psychology and Christianity. It's definitely an interest of mine. I'm by no means an expert in all of this, but I hope that I could provide just enough of an overview for you that as you're wanting to pursue more, you'd be able to. Obviously, in your program, you're getting a lot in terms of biblical counseling models for doing your counseling work. And my training has been in clinical psychology. I attended George Fox University, which provides some classes on spiritual integration, but a lot of this work is more just kind of things I've pursued out of my own interest as a believer. The integration of psychology as a science and Christianity has kind of had four waves over the course of really since the 60s primarily. The first wave is kind of just apologetics, basically sort of saying, whoa, how is it that we can integrate psychology, something that seems so secular, in Christianity? And kind of answering questions in terms of where those felt very opposed to folks. And obviously there's folks for whom that's still probably the most relevant question, and I hope to address some of that even in this discussion. Primarily, the writings in that apologetic framework went from the 60s through the 90s. And from the 90s into the 2000s is where folks proposed models of integration of psychology and Christianity. And I'll share a little bit in terms of some resources where you could learn more about that. But trying to create cohesive models that bring the two together or demonstrate how the two are so intertwined and are not two separate entities. Lots to all of that and more than I'll go into tonight, but I just want to touch on some of that with you. That has really moved more into research in terms of providing a foundation of evidence base for both counseling practices, but more just sort of spiritual principles or phenomena such as grace, love, joy, wisdom. Those are all psychological principles that are being studied through psychological means now, measured in ways to try to understand, are we able to look at those aspects of the human experience just as we would any other, in the sense of trying to understand what's happening, what people are experiencing, and what we can learn in terms of best practices from that as well. And kind of the wave that's suggested that we're sort of in now while research is continuing is sort of this idea of embodiment as an integrative approach. One that ties in apologetics, models, but emphasizes sort of the real present moment embodiment of Christ in the therapy room, particularly in our Western civilization as we meet people who are in sort of a postmodern context of how do we bring these things that in some ways were pre-modern and modern in a way that at least makes sense to people who are more in a postmodern context. I want to suggest first on kind of that vein of apologetics that psychology is part of everything. Sometimes we reduce that down and say, well, psychology and Christianity don't mix well. But I just want to suggest that if we really just stop and think about it a little bit, that I don't think that they can be separated. So, for instance, I think of pastors who might really be anti-psychology. Really, I think the moment they say anything other than directly quoting the Bible, they are engaging in psychology in some way. In other words, what they're saying are coming from psychological processes and then filtered through that, given to others who then hear that through psychological processes. And a good pastor tries to match what he says in a way that then people are going to receive and hear. Those are psychological events. But even our English translations of biblical texts involve psychosocial processes, are culturally laden. And so psychology pervades even the most sort of strictly spiritual or Christian acts. I have copied here part of your model, at least from your materials for biblical counseling. And I will admit, I don't know these materials perhaps as well as many of you do. So forgive me if I oversimplify. What I want to kind of point out from this is the idea of mental health in this model seems to sort of be captured by this that second area or sphere of physically embodied. In other words, this idea that we can understand the difference between spiritual and psychological on the basis of what is sort of immaterial and what is material or matter. In other words, the brain. And while so much of psychology is rooted in the idea of the physical and the brain, I want to actually suggest that misses a lot about what psychology has to provide. And I think if we understand psychology from not just being something that's physically embodied, but something so much more than that, that it helps resolve a lot of the tension that sometimes seems to exist between Christianity and psychology. Specifically, I want to suggest the idea that psychology is not just about the brain, but the mind. In other words, there's something that's not just our brain that we call the mind. It's something that is less concrete, a little more complex and nuanced in what we mean by that. But as we sort of elucidate what that even means or looks like and things that we just commonly experience and talk about in our daily lives, I think it becomes clear that there's psychology covers a vast part of our human experience beyond what we would just call physically embodied. So psychology is defined as the science of mind and behavior. And that's just important to realize that when we talk about psychology, we're not just talking about neuroscience. That's an aspect of psychology. But we're talking about behavior as well. It encompasses more than just counseling as well. Sometimes when we think psychology, we're picturing just what happens in a counseling office. Well, psychology is a vast field, and it's a science that informs what happens in counseling on the basis of other thoroughly tested realities of human experience. I feel like Christians who have kind of despised psychology, in fact, use psychology in their very art of making an argument or engaging in persuasion. I mean, even the art of persuasion is something that is deeply rooted in psychological sciences, thoroughly tested of how we do that, of how people are most influenced. And I also just wonder why we would be wary of being very thoughtful on the basis of scientific research to inform how we understand and interact with each other and with our clients. Because the alternative of rejecting, for instance, research or what says of things that tell us how people really are feeling and thinking and interacting deeply, we may just sort of default on sort of haphazard interactions with people on the basis of sort of anecdotal evidence or just our own experience and what immediately makes sense to us without critical thought. And that may be good in some cases, but could also lead us to pretty sort of simplistic and reductionistic approaches or explanations to what we're experiencing with people. And frankly, I think that treating clients or our interactions with others in that way kind of demeans God's glory that's manifest in the rich and complex depths of people who are made in God's image. And you may have heard the adage that all truth is God's truth. In other words, that's been used in terms of the reconciliation of any scientific field with Christianity to say, whatever we find that does seem to be true about the world, about the natural world or us as people, that we're discovering God's truth. He made the world, he made the universe, he made us as people, he made our brains, he made the complex ways of what happens when we have positive things happen in our environment or things we experience as negative and all the repercussions of that. God designed that. What we're finding in these things is God's truth. I want to look at some scripture on this idea of the mind being more than matter, and then look at some science on the idea of the mind being more than just matter or something physical. The Hebrew word for heart, there's lots of ideas kind of floating around as I research this, but it seems to boil down to the idea that the heart, the Hebrew word lav, is sort of the center of the mind, the will, and the emotions. Some idea of the mind, our thinking, our experiencing of reality, of consciousness, our will, our actions, our ability to enact what's going on in our mind, in our emotions, what we are experiencing. And not just, things like joy and happiness, but things like gratitude or more sort of nuanced, more experiential things. I heard a pastor one time say, psychologists deal with a head, I deal with a heart. In a way where we kind of relegate psychology to, again, this physically embodied thing. And I think that's very far from the reality if you just talk to psychologists in general. And even those who are practicing psychology, there are different approaches, of course, and one is very behavioral. But even those who are the most behavioral, focused on the way that we think and the way that we act, acknowledge the immanence of our emotions, the immanence of that being a part of our experience. They might define those differently as sort of cognitive experiences, but we all understand and are dealing with the richness of human experience emotionally. There's kind of this, I think, pretty restricted in the Protestant church and in the West of this idea of fact, faith, and feeling. In other words, that fact comes first, then faith and feeling, or the idea that fact is like the train engine, faith is the coal cart, and then feelings are the caboose. They don't matter. or they're not as valid. And I think I can honor and respect some of where that's coming from in terms of, especially as we see sort of in the postmodern world where so many people are putting their experience of reality as their epistemology, their way of knowing, that's how they determine what fact is purely on the basis of experience. But I don't think it, and while I totally disagree with that, that doesn't mean that's the only way of looking at validating our feelings as more than just the caboose or something that doesn't matter. In fact, what we determine to believe as facts or true can be based on and are based on some combination of our thoughts and our emotions. And just thinking about it biblically, I'm not sure why one should be lifted up as higher than the other. The Bible kind of speaks pretty clearly about all of that, and especially our thoughts, that our thoughts are just as deceptive, if not more, than our emotions. And I put a link here to an article on Desiring God by John Piper that really kind of grapples with this more than I'll take the time to do here. But think about some of these scriptures. The Lord saw how great the wickedness of the human race had become on the earth, and that every inclination of the thoughts of the human heart was only evil all the time. I mean, just that alone sort of baffles me when people say, don't trust those feelings. You need to just stick with what you know to be true. In other words, thoughts. What are you thinking? But I think that doesn't do justice to the complexities of us as human beings made in the image of God with feeling and thoughts and all the richness of experience in between the two, which is what psychology is really about. Luke 10:24, love the Lord your God with all your heart and with all your soul and with all your strength and with all your mind. In other words, there's lots of terms there, 4 of them in Luke. And I think that the list would have been longer, but he kind of captured everything he wanted to capture there. In other words, it's saying there's a lot to human experience, and we just want to kind of put it all out there. There's lots going on here. And in this case, in the best sense, use all of it to love God, and I couldn't agree more. Let's think a little bit about science on the mind being more than matter. And especially as I go through this, I'm wanting to sort of help you be thinking about psychology as a science that is more than just counseling, but then be thinking about how approaching human thought and feeling and experience on the basis of science richly informs what you can do in your counseling. So think about this, the idea of human consciousness. What is that? And I don't think anyone has that well defined in terms of mapping how that works in the brain, that there's something beyond just neurons firing that involve our sense of being conscious, aware. What about temperament? Temperament is this idea that we're born with a certain way of being in the world, that from the youngest age we can separate infants into different temperaments, easy and difficult. And some of you as parents may have experienced that difference in your kids, that just they were born and their experience of the world and of their emotions and thoughts and trying to balance all that out is very different. What is that? What is that about? What about personality? These sort of pervasive and ongoing ways of being in the world. Is that strictly biological? Is that how much of that is from what we're experiencing as we're growing up? And is that just rooted in physically embodied or something more? Do we separate that entirely and say it's our soul? Or is it somehow a rich complexity of all of that together? And that's really what I would want to suggest. The idea of attachment, and specifically attachment security. Lots of psychological research that even from infancy, we can do an experiment where we have an infant with a mother, and we put this infant through a certain test that involves separations from the mom and then the mom returning under a different set of scenarios. And the infant will respond in different ways such that we can actually categorize how secure that infant feels. In other words, how well has that infant been able to take in and internalize a sense of security and being able to count on and trust that his or her mom or primary caregiver is there for him or her. And that in fact, what we can assess even in infancy seems to pervade the rest of life in terms of how secure we feel in our relationships. What's that about? Is that simply spiritual or simply psychological? Is it simply something non-physical or physical? It's a complex interaction of all of that. What about just the idea of interpersonal dynamics, our ways of being with others? That involves some of these other things like attachment and temperament. But that's a big emphasis in counseling, that people present with all kinds of symptoms, but at the core, very often, what seems to be underlying all of that is something relational. And I think that fits well with what you study as well as biblical counselors, that something in our hearts was off in the fall. We have disconnected from our God, our Creator, and that pervades now all of our human relationships. But looking at what actually does that, how does that play itself out in the human heart and mind in our daily experience? That's what psychology looks at, and we should be so thirsty to learn everything that we can from that kind of research to shape and inform what we're doing with people. Thinking patterns. This might be getting more into sort of the brain. In terms of our patterns of thinking, you've probably heard of cognitive behavioral therapy, and it's pretty popular and fairly effective, and it really looks at parsing out how people think, and specifically looking at the ways that our thoughts, feelings, and actions, if you think of that like a triangle, are all interact. And that if we intervene in one place or another, then it can change the negative cycles that people get themselves into. What about attribution styles? That's in a similar line of sort of cognitive psychology, and suggests things like depressed people tend to attribute anything that happens to internal, stable, and global causes. In other words, I'm to blame. I'm a total failure. It's all because of me. Whereas those who are not depressed tend to have a different attribution style. They attribute things that happen more to external, unstable, and specific causes. In other words, looking at how situations, or they look more complexly at things to understand that it's not always just about them. What about the idea of defense mechanisms? We've all experienced that, and we all have our own. In terms of, some of the more common ones that we'll hear about is denial, denying our anger and things like that, and the way that bubbles up in all kinds of other ways. Or the use of humor. They're very common to get patients who are smiling a lot, even when they're talking about just awful things that have happened to them, because that's helping them not feel the pain. What is that about? Is that just something in their brain that we can put a pill to and fix? No, there's something much richer and deeper going on there that is the mind, something beyond just what's physically embodied. Think a little bit about even psychiatric medications. Those are obviously directly impacting things that are happening in the physically embodied realm of the brain. And yet, frankly, a lot of those medications, if you look on the label at what's the action, what's the mechanism of change, many of them, you know what they say? Action unknown. We just know it changes something in terms of how people feel, think, or what their symptoms are. And so even things that do hit at a physical level are affecting things in ways we don't even understand. And then this ongoing debate in psychology about nature versus nurture. So in other words, to what extent are the symptoms or things that we see in people's lives because they were born that way, because of their genetics, or because of their experiences personally, socially, in their families that shaped them into the kind of person that they are? And that tends to be basically the way that most people think is, well, it's always some combination of the two, and I agree. However, I think we're very quick to conclude or to reach conclusions prematurely. For instance, people will look at studies about, for instance, anxiety and how rates in a family tend to be high, moving from like a parent to their kids to grandkids. It's like, well, clearly it's genetic because the rates at which their kids and the next generation have anxiety is higher than just the average population. But that's silly to look at research and just conclude it must be genetic because of that, when imagine from that youngest age as an infant growing up in a home where everything is high anxiety and high strung all the time. If that's your way that you've learned to live in reality from that youngest age, you learn it. So there's some combination in which even the research, don't jump too quickly to either conclusion. It's complicated. And that's really all I'm trying to get into your mind, is that looking into the research and wanting to be a lifelong learner and looking at and using even secular science to help us understand the truth, because all truth is God's truth, of what are people experiencing and how do we interact with our environments, is deeply important and will inform and honor God in the work that you're doing with people made in His image. I want to look a little bit at sort of the interaction of neurobiology, the mind, and our environment. So specifically, something that some of you may have already looked at, I think you've had some special training already on trauma. But that is deeply intertwined with even our brains. So I just want to step back for a little bit and think, yes, we are physically embodied. Part of psychology is looking at the physical, at the brain. And the image on the screen here is comparing the brain of a healthy infant and one from a Romanian orphanage, where many babies after the war were left isolated, alone, without much human contact, without that contact of skin to skin, without attention, without hearing human voices, without the sort of interactions, without even like stimulation in their environment, the sorts of toys and things that stimulate attention and creativity in infants. And when you give them tasks, you can see that whole parts of their brains are just, they're not lighting up. In fact, the brain structure itself is highly different. Their brains tend to be smaller. Ventricles are wider, which means there's more empty space in the brain. And so there's just less there. And that is a lifelong consequence of early childhood trauma, or in that case, neglect. And this is a big area of research ongoing in terms of sort of the neurobiological correlates of trauma, in terms of physical or sexual abuse, neglect, things like that. And even of more subtle things like an emotionally misattuned caregiver to an infant, and the ways that that can have a long-term impact in terms of the parts of the brain that we can correlate to things like empathy. There's also a whole field of study that looks at epigenetics, which means that there's something that changes in terms of the mechanics or the way that our genes are expressed, but aren't necessarily changing the genes themselves. And interestingly, things like trauma now, they're linking to, in one generation, this parent abuses this child, and you actually see epigenetic changes in the next generation. Even if this generation doesn't abuse this one, you see changes in terms of their epigenetic expressions and their brain structure at that point. So, I mean, think about, even as Christians, this idea of the passage of God's judgment upon sin from generation to generation. That's not like God's having to do something, magical to make that happen. It's a reality of us as a psychological beings that this gets passed on. And now we have language to talk about that in terms of epigenetics, our DNA function, this idea of gene transcription. We're looking at, again, all truth is God's truth, that we're seeing the ways these biblical realities are being worked out. What about just the idea of neurotransmitters, these things floating around in our brain that send messages from cell to cell? For instance, depression. Most of the medications people take for depression and anxiety are called SSRIs, selective serotonin reuptake inhibitors. The point of that is that it puts more serotonin, or leaves more serotonin in the brain, because serotonin levels seem to be lower for people who are depressed. So we say, well, hey, let's increase the serotonin and they'll be less depressed. And so people say, well, depression clearly means that there's something with the brain that's not producing enough serotonin. But really the question that you should be asking is, well, which comes first, depression or low serotonin? Because someone could be depressed for all kinds of reasons, including the spiritual reasons that you are especially well trained to think about. As a result of those spiritual things, we see something happening expressed in their physically embodied cells, namely low serotonin. Now, while we can even if that's the case, we can get them more serotonin and they may feel better, but it doesn't resolve any of the reasons why they were depressed in the first place. Likewise, though, Sometimes there are things where it's just the brain is not producing what it should, just like anything else in the body that's not functioning the way that it ought to. And that by helping someone get more serotonin into their brain, they're able to more be themselves and function well. So again, there's complex interactions in all of this. We don't want to jump to conclusions too quickly in any of this. I've often heard people say, why give someone a Band-Aid, namely secular counseling, when you can give them Jesus? And I feel that. Evangelism is probably the most important thing for me in terms of outside work and what I want to do in the church and in my neighborhood. I care about people knowing Jesus just about more than anything. And so sometimes people say, well, why are you doing secular counseling? Well, let's think about that. Would you say that same thing about giving someone a Band-Aid if someone comes to make a withdrawal from the bank? Well, don't give them their money, give them Jesus. Or to order food from a restaurant, don't give them food, give them Jesus. Or to have their swollen appendix removed at the hospital, would you say, I want to give you Jesus and not remove your appendix? No, of course not. I think that sometimes psychology borders on things that we seem to more rigidly separate as, but that's spiritual. And again, I hope that even through everything that I've shared so far, you're seeing that it's more nuanced than that, and that you can do both. And I want to suggest that they're complementary. In other words, giving Jesus to someone and helping them from a psychological perspective complement each other. For instance, think about, does God even have to categorize our experiences as strictly spiritual, physical, mental, psychological, whatever? Does God think of it in categories? I think that's a human way of helping us try to understand realities that are way beyond what we can fully grasp. And that God looks at all that and he looks at it differently. And I don't know how he does because it's beyond me. So we have our categories that are helpful, but I just want to suggest that from God's perspective, these things all overlap. So we want to be careful that we're not creating artificial and rigid separations that God himself is not making. Likewise, I want to think about the fact that people gain psychological resources for engaging with spiritual realities. In other words, sometimes I've had the fear that, when I see someone really depressed, isn't that in their crisis? That's the opportunity for them to know Jesus. But at the same time, when you really get to know people who are in serious psychiatric crisis, their ability to think through and engage with spiritual realities, much less reality of any kind, is very limited. And so through ways of helping people get to where they can think more clearly and feel and get out of bed and not be sleeping 20 hours a day, things like that, that is helping them have the resources to engage with spiritual realities. So for instance, I was thinking if Christianity was like teaching someone to play a baseball game and they came and they weighed 700 pounds, your first thought would not be, okay, let's get them out and with the bat and swing it. They'd probably have a heart attack and die. You've got to help them lose weight. You've got to help them get fit so that they can even begin to walk down onto the field. And I think similarly, psychology and therapy can be used to help people even get into shape in terms of mentally and emotionally, where they can begin to actually even have the wherewithal to grapple with, what's this game of baseball? What is this reality of what Christ has done for me? So I want to suggest that we think about those needs that people may have before we jump too quickly to the thing we all want people to have more than anything, which is Jesus. Likewise, for me personally, I love being in the role that I'm in because I want to work primarily with people who don't know Jesus. I do love to work with believers because and as I'll share in this presentation, ways of being able to integrate faith and psychology is really precious. However, I want to be able to bring the gospel to non-believers. So I find that even in my role as a therapist who sees mostly people who are not Christians, or who at least are lots of nominal Christians who are not real involved in their faith, I love being in a place where they come to see me. And then I'll share some examples in terms of what that can look like in terms of slowly but surely helping them move in a direction towards Christ. I appreciate what you guys are doing in terms of biblical counseling for the church, because those of us in the church need those places to richly have our faith and use the Bible in ways that address our deepest concerns. But I don't know how many folks that you see who are coming from a place where they would never show up to a church. I trust that there are some coming, and which is awesome that you can meet that hunger more directly because they know they're coming for biblical counseling. I feel like I'm able to also see people, though, who would never show up at a church or never go to biblical counseling and still embody for them and even point them towards Christ, sometimes more overtly than you'd think, and that people are almost always very open to. It's amazing. And maybe that's the power of prayer. And again, I think that goes along kind of with Paul, the idea of I've become all things to all people so that by all means possible I might save some. And I do think about that in terms of the work that I do. And that's just for me. I also think that being in the role that I'm in has helped me, where in missions work and youth ministry, it's really easy to kind of get a God complex, right? I would just grieve over people who would reject the Lord, or go through middle school and high school with people and then see them reject the Lord. That does grieve my heart. However, being in a role like this as a therapist now does help me to really experience God's sovereignty, as He gives me the honor of getting to sit with someone who does not know Him, as far as I know, and to love them and care for them and be gentle and helping them get to a point where they may be able to open their eyes to think about bigger things than themselves is an honor. And it helps me stop having to feel like I need to be God, and to trust in God's sovereignty, and to know that even if I don't lead them to the Lord in the course of counseling, though I'm open to that and pray for that possibility continues to exist elsewhere, and that I may be helping people be more open to that by the time they leave therapy. Just to speak briefly to this idea of models of integrating psychology and Christianity, a really good book that's used in all the sort of programs like mine that try to talk about integration of Christianity and psychology. This is probably sort of the essential book, Psychology and Christianity, 5 Views, edited by Eric Johnson, and it just presents for you kind of a summary of the 5 main views that have sort of emerged over the last 50 years. And definitely recommend that if you're interested in more. The one that I'm most drawn to is called Christian Psychology. And that really is like its own school of thought, not just, oh yeah, Christian and psychology. And Eric Johnson is kind of one of the leaders in that field. And that basically just says that the idea of what we're trying to do in counseling has its roots really in Christianity for the last 2,000 years, and in Judaism, from which our faith has come long before that, and trying to really not just bring psychology and Christianity together, but to say, no, we're starting with Christianity richly. That is reality. That is where everything begins and ends. And hey, there's some things that psychology are providing that can really add richness, and because of our limits. We don't need to bring psychology in because of God's limits. We're bringing it in because of our limitations as people to understand ourselves, let alone other people. So I want to now kind of change gears and provide a little bit of an introduction to psychopathology or mental illness for you, in terms of both understanding a little bit of sort of the main big diagnoses that you'll see, and some thoughts in terms of when you might consider referring them for psychological help to someone like myself who works with people non-medically, or to refer them psychiatrically for potential medication evaluation. The DSM-5 is the text used by mental health practitioners for diagnosing people, and it's been through 5 iterations. And it's based on the medical model. So even the idea of mental health or a mental illness, we talk about these experiences in the same way we would talk about medical problems. Lots of people in the field don't like that, myself included. It doesn't feel like things fit rigidly into that model, but it's comfortable for people. And I think that it helps people be able to say, hey, I have this thing. And it is helpful and assuring for people to be able to sort of have labels for their otherwise very complex and often disorienting experiences. But let's look at that a little more closely. Diagnoses in the DSM, they are a label. That is all they are. They are a label for a set of symptoms. If you are experiencing this, and this, we're going to call it this. It's a little different than a medical thing where we can actually look and take your temperature and even look at your blood and say, you've got a virus, and here it is, and here's what we're going to do about it. This is more nuanced. We have our own book because we don't have a set of, here are all of the sort of biological realities of why we can, we can't strap a thing on your brain and say, here's your diagnosis. It is more nuanced and complex than that. There are not necessarily biological realities that we can point to for, and label it depression. We look at symptoms. And so I would argue that a diagnosis doesn't necessarily mean you have something. The way I have cancer. This is different. It means you're experiencing a set of symptoms for many possible reasons, and we don't want to jump to conclusions about what that may be. And I think that's a richness that you bring into things, especially from a biblical counseling perspective, is to understand how deeply spiritual and characterological so many of the issues that we're seeing are. That's more of a spiritual illness than something that is a mental or a brain illness of some kind. And thinking about diagnoses in the DSM-5, even the way a diagnosis is expressed, the way it looks like in somebody, can vary widely. So for instance, you might have 8 symptoms for a disorder, but you only need 4 of them to get the diagnosis. So you may have someone walking around who meets these 4, and another one who meets these 4, and they don't even overlap, but we call it the same thing. Often it's more nuanced than that, but keep in mind that there is no one depression, there's no one ADHD, that these things and how we label them are more complex than that. Diagnoses are made on the basis of functional impairment. In other words, you can have all kinds of symptoms and we wouldn't label you with a diagnosis oftentimes if there's no functional impairment. In other words, something's not working out right for you socially, academically, vocationally, or you're just experiencing what we call clinically significant distress. In other words, it's very relativistic. We don't have the basis of the idea of truth, the idea of having it or not. It's, does this disturb you? And if so, we're going to call it an illness. That's really tricky because a lot of the DSM really has been significantly influenced by things like politics and economics and society. So the DSM-3 had homosexuality listed as a mental illness. Why was that removed? Some people came to basically the one person who's been in charge of the revisions of the DSM, and they were gay, and they said, hey, we're gay, we don't feel like there's anything wrong with us, and we want you to take it out. And they did. That should be a little shocking to you, but that's sort of the basis in a postmodern world for what we call troubling or illness, is saying if you feel like it's hurting you in some way or it doesn't sit well with you, we're going to call it an illness. So again, I just want to suggest that while the DSM is useful in terms of having a common language, when we say someone's depressed, okay, at least that gives me a little bit of an idea of what's going on, but not much. There's so much more to it than that. So let's just look at depression, for instance. When people say, I'm depressed or I have depression, there's actually at least 15 diagnoses that involve depressive symptoms. So again, even in the DSM, it's more complex than that. Let's just look at some of the basic symptoms of when most people say they're depressed, usually the diagnosis is called major depressive disorder. Some of the symptoms: depressed mood most of the time. In children and adolescents, depressed mood may mean more, it be expressed as irritable mood. Anhedonia, which means sort of a lack of interest or pleasure in things. Feeling really fatigued all the time, having sleep difficulties. And with depression, that can look like just being up all night, waking up, restless sleep, unsatisfied sleep. Often it means early morning awakenings, this idea of I'm waking up in the morning, but way before my alarm and I can't fall back asleep. Maybe decreased or increased appetite or weight significantly over a short amount of time. Diminished concentration, just not being able to focus. The idea of it's kind of long word, psychomotor retardation or hyperactivity. What that means is feeling like really your movements are either like way slowed down or way sped up. And sometimes you can notice that with people as you're sitting with them. Feelings of worthlessness or excessive guilt. That is a key distinguisher between depression and grief, because you're certainly working with people who at times are experiencing a lot of grief, and they may have a lot of these symptoms I just went through of depression, but they don't have major depressive disorder, largely because in grief you don't have this prevalent idea of I feel worthless or totally guilty. And so that's an important distinguisher between grief and depression. And then suicidal ideation is a symptom of depression and a common experience for people who are going through that. Possible reasons why you might refer someone to a mental health provider when they're going through depression. A major functional impairment, like they are pretty much not leaving their house, they're just in bed all the time, they're not able to get to work, that kind of thing. That even I would really suggest needs some medical attention. Even if, let's say, even if their depression is entirely because of some kind of spiritual issue in their life, giving them some medication to help them, again, get some psychological resources again, is really going to help your work with them. And it's not like they're going to have to be on that forever. They get on it to improve the work that they're having with you. And then come off of it. And hopefully they then resolve the underlying things so that once the medication's removed, they can continue to do well. However, when someone's sort of resistant to treatment, like you're trying everything you can and it just seems like nothing's changing, things are getting worse over the course of a long time, definitely consider referring them for further treatment. And when I say refer, I don't mean stop meeting with them. I just mean let's complement the work that we're doing with each other in terms of having sort of a multimodal approach to it. And then certainly if you're seeing folks with suicidal ideation, where they really are planning that, they've got some real concrete ideas of how they do it, and they're saying like, I really want to, I'm really worried about my safety, or especially if they've had a significant prior history of attempts, that predicts future attempts. And so you really do want to treat that seriously and refer them for their safety. And I would say if they have a really profound history of trauma, that you really want to consider that this may be really complex in terms of what the approach is going to take. While there is very much the spiritual component, continue to work with them. However, there's probably other things going on, as I hope I've kind of elucidated at this point. There's lots of things going on. It's complex psychologically. And so I think that having some other folks be able to look at that and work with them on those things would be important and complement each other. And if there's really, you're working and it just seems like there are no identifiable sort of situational factors, you're like, man, this person just seems spiritually healthy. I mean, all these things going on, but they are still really struggling with some of those symptoms of depression. That's especially a chance to refer them for psychiatric evaluation, the potential for medication. There are lots of reasons biologically that can lead to symptoms of depression. Particularly things like your endocrine system getting off, thyroid issues, those can really mimic depression. Anxiety. There's also multiple diagnoses that are referring to this idea of anxiety. The most common is called generalized anxiety disorder. Some symptoms of that includes anxious and worried thoughts most of the time. It's like most of the day, almost every day of the week. Having difficulty being able to control those thoughts at all, just feels like you can't help but have those thoughts. Feeling restless, keyed up, or on edge, having sleep difficulties. And anxiety compared to depression, that's often more like an inability to fall asleep, to initiate sleep, where you're just up for hours and your mind is going, or where you're waking up a lot throughout the night. Feeling just really easily fatigued, like you just do a little bit and you're wiped. Again, diminished concentration. There's some overlap here with depression. Muscle tension, especially like in people's necks or clenching their jaw where they'll complain of pain, or you just ask them, hey, does your neck hurt very often if you stop and think about it? Quite a sign of anxiety. And then irritability. If you're seeing people and they're coming in, maybe a couple, and they're having more conflict, be thinking, gosh, could there be some anxiety in someone that's leading them to just really get into a lot more fights with someone and feeling irritable? Possible reasons for referral when it comes to anxiety, again, major functional impairments, like they're just so nervous to get out. Often that comes in social context. They're missing work because of it. They're not able to come to church, things like that. You definitely want to refer them, again, to get that boost so that they can do the work with you, resolve the underlying reasons for it, and move on with their lives. Refer, again, if they're just really resistant, you're really trying, and it just doesn't seem like they're making progress. And similarly, if there's no identifiable situational factors, similar things like thyroid issues that can manifest as anxiety. Post-traumatic stress disorder is very common. Symptoms, the person has to have been exposed to actual or threatened death, serious injury, or witnessing serious injury, or very often sexual violence. And that's been, for me anyway, the most common reason I've seen people with PTSD is usually like a sexual assault. Sometimes it's from childhood abuse, physically or sexually. Signs that you'll see are things like people talking about intrusive symptoms, the idea of just things coming at them that they're not bringing up, of nightmares, flashbacks, memories. They just can't stop like reliving it again and again. They may be engaging in a lot of avoidance. They're avoiding going places, being around people that remind them, avoiding men in general if they've been sexually assaulted. And sometimes it's more subtle than that, things like a smell or something where they'll avoid places that would have that. There's going to be negative alterations in mood or cognition, the way that they're thinking. This looks like depression or anxiety. And you want to be careful to not too quickly think, oh, they're just struggling with depression because they're endorsing some depressed mood. Well, check if there's been some real traumas like this, because it may be that it's not so much they have depression, it's that they have PTSD with depressed mood. Often there's marked alterations in arousal or reactivity. What that often looks like is like a strong startle response. Maybe if they sit at a restaurant, they're always going to be somewhere where they can see the door. They don't have their back to that. Always kind of on guard and on defense. Possible reasons to refer folks with PTSD or that you suspect may have that. Again, major functional impairment, they're resistant to treatment, or they've got suicidal ideation. What about ADHD? That you can see in children, adolescents, adults. It looks a little different in adults, but really can make a big difference. And you need to be able to parse that out, especially if you're working with families or you're working with parents who are exhausted trying to deal with their kids. Symptoms of that are broken down into two categories. The first is inattention. It includes things like having trouble focusing on details, making careless mistakes, trouble listening, following through on things, organizing their tasks, resisting mental effort, procrastination, losing things all the time, being really easily distracted by external stimuli, their own thoughts, feeling very forgetful. And then the second area would be hyperactivity, fidgeting, squirming, kids who are jumping up and out of their seat at times they shouldn't, or running and climbing on things when they absolutely shouldn't be, feeling like they've got this motor always driving them, talking excessively, blurting out answers, interrupting people, having trouble waiting their turn or being in lines. Now, again, some of those things, don't jump to conclusions because some of that is normal kid stuff, right? But if we see that in multiple contexts, it's way beyond what we would expect for a kid, then we're going to say, okay, maybe something more is going on here. We used to parse these out as two diagnoses, ADD for attention deficit disorder. It's all just called ADHD now. And then we put a qualifier on that says primarily inattentive or primarily hyperactive or combined presentation, which is often the case. But what is ADHD? Basically, it involves a range of executive function deficits. So executive functions are basically different parts of your brain that regulate and tell you what to do and how to do it. So on this image, there are 33 executive functions listed under 7 categories. Executive function is kind of like an orchestra conductor who's up there trying to make everything work together well. And then you have section leaders. And those section leaders are kind of like each of these categories on this handout of attention, engagement, optimization, efficiency. And the orchestra director is your prefrontal cortex. It's this part right in the front of your brain that's trying to sort of cue and coordinate all these other things to work together. ADHD theoretically is where the prefrontal cortex is not active. It's hypoactive. It's kind of like the orchestra director is kind of taking a nap while everyone's playing their music, and then the section leaders don't know what to do. And so treatment for that typically is a stimulant to sort of activate that, to turn that back on and get things coordinated again. You want to keep in mind, though, that there's a lot of reasons why people might have these sort of executive function deficits. And like I said, there's theoretically 33 of them. And one person with ADHD may have a few over here and the other some over here that don't even overlap. And so it's complicated in what it will look like. And likewise, in terms of how we treat it, by turning on the prefrontal cortex, that tends to just get everything stimulated. And so actually there's kind of a debate on the use of stimulants because we don't know exactly what ADHD is, why the prefrontal cortex might be hypoactive. We don't know why. We just know, hey, if we put a stimulant that's not a lot, I mean, it's a lot like meth, and we're just giving that to you and saying, hey, it makes people perform better. I mean, some people would say, well, why are we just throwing that at kids, especially? For instance, we outlaw performance-enhancing drugs in the Olympics. Just because it enhances a child's academic performance, does that mean we should give it to them? Or are there other reasons maybe why we're seeing these executive function deficits? I've worked with lots of kids with ADHD, and I do try very much to use behavioral interventions to help them, and that usually looks at compensatory strategies for those executive function deficits. Lots of organizational strategies and reminders, all the things that should be happening here but aren't. Thankfully, even technology is a good thing when it comes to this in terms of helping people have tools to remind them and to keep things organized. And don't think I'm a total critic of ADHD and how I was talking about the use of stimulants, but I want you to know that there really is a debate on what that even is and whether we're treating it correctly or not medically. But certainly behaviorally, there's a lot that we can do to help people, kids and adults, with ADHD. Possible reasons you might consider referral to a mental health practitioner just for more behavioral work like I would do with them, or to a psychiatrist for medication evaluation would be major functional impairment for the individual, but also assessing for the individual's family or their spouse. If you're working with an adult, you're going to see impairment in the whole family when a kid has ADHD. Think about the parent who comes and says, oh my gosh, I just don't know what else to do, and things are just chaos, and okay, be looking for that kind of thing. Or when you're working with a couple and there's trouble going on, don't keep this out of your mind just because there's relational concerns. It's all interconnected. Relational concerns may mean, hey, there's something going on for someone that needs to be addressed, and it may be ADHD. A big part of that is emotional dysregulation. That's very common. Our emotions are regulated in front by that orchestra conductor, that prefrontal cortex that helps us balance our emotions and work them out in reasonable ways. If that's asleep, our emotions are going to just have their way. You want to be thinking about children not responding to treatment. If you're really working with them, it just seems like they are still out of control, refer them. And like I mentioned, watch for the exhausted parent, the one who is just, I've tried everything and they're out of control and I'm embarrassed to even take them out in public. Or people who are feeling judged, especially in the church when they have a kid who seems out of control. Let's not judge those things when there may be a lot more going on than a bad parent or something like that. There's lots of reasons for why a kid might be acting out, and let's not be hasty. Let's be gracious and understand that human experience is complicated. And I hope that if there's nothing else you take away, that you're hearing that, and that helps you be alert and open to what you're seeing in the people who come your way. And then finally, let's be thinking about personality disorders. These are complicated, and you're not going to need to necessarily diagnose that. And people may not have a full-blown personality disorder, but still show significant traits of a diagnosis. So, some examples are all of the different personality disorders include paranoid, schizoid, schizotypal, antisocial, borderline, histrionic, narcissistic, avoidant, dependent, obsessive compulsive. The ones that you probably hear people talking about the most are ones that fall into cluster B, as they've called it, a borderline, histrionic, narcissistic. That tends to be more what you would actually see in therapy. And just keep in mind that personality disorders are pervasive ways of being. It is a way of being in the world, and especially in relationships. It's not something you're going to be able to just shift through, including myself, through any kind of psychobabble or tips or tricks. And it usually involves a very deeply fractured sense of self, that there's such an instability in how one experiences themselves that then the whole world and all their relationships are experienced as unstable and chaotic. Therapists, frankly, often avoid people who are coming with symptoms that sound like a personality disorder, or if they've already been diagnosed. That should be telling to you too if you're trying to work with someone that. Do it, see how that goes for you, but just realize, hey, if you're feeling like you're getting in over your head, don't feel bad because plenty of seasoned therapists would feel the same way. Things to watch for, to just kind of notice if, gosh, is there something here in terms of like a personality disorder or traits, would be someone who's coming with like an extremely turbulent and unstable relational history, lots of marriages, divorces, family drama, cut off communication from people, really poor, unstable employment history, substance abuse, illegal history. And then in terms of them working with you may just be shocked at some point where there's just these like sudden inexplicable changes in how they're relating to you. They may idealize you at one point, and then they come in and they're just like assaulting you verbally and hate you. And it's like, whoa, where did this come from? Don't take it personally. Don't get engaged in it. Just hear them out, have some firm boundaries, get them out at the appropriate time, and realize, okay, there's something going on here that is beyond just normal, I did something wrong, that there may be personality disorder concerns going on, and refer them. Some general treatment emphases, things to just be thinking about in terms of treatment. I spend a lot of time just on healthy lifestyle behaviors with people. This is that physically embodied part where not just the brain, but the brain's part of the body. Research suggests that as much as our psychiatric medications can help people, for instance, with depression and anxiety, there's 4 things you can do that are even more effective, if you can do them, than even our best medication. That's drinking a lot of water all throughout the day, eating healthy, regular food where you're spreading it out throughout the day, especially green leafy things, getting lots of regular exercise, and sleeping well. So you can spend a lot of sessions on just those things. And if that's not something that you're wanting to do, refer them and let's coordinate our treatment to have someone who's helping them with those things and someone who's really delving into the biblical aspects of what someone's experiencing and why they've come to you. There's this research on the common factors in therapy. This is basically saying, what is it that's effective? What changes people? Is it all the tips and tricks and tools, or is there something else? And basically what the research shows is that overall, in the end, the thing that has the biggest impact on people is the quality of the relationship with a therapist. I mentioned earlier in terms of when we were talking about that the mind is more than just something physical, this idea of the mind. It's more than the brain. The relational dynamics are a major part of that. And I think that reflects the fact we are made in the image of God. And so it makes sense that the therapeutic relationship is itself such a powerful tool in helping someone gain new experiences relationally, as opposed to perhaps destructive patterns in relationships they've experienced over the course of their lives. I want to talk for a moment about psychological theories of personality. These are just, there's a few different schools of just these grand ideas of trying to explain the human experience theoretically. To some extent, usually based on research, sometimes not so much. Those are very informative, but can also really leave the realm of science and become a philosophy or a worldview. And that's where we get a lot of the conflict between Christianity and psychology, is when we do delve into this idea of theories of personality. Many approaches are influenced by humanism, which obviously does not sit well with Christianity. It's founded on belief in human goodness, and so kind of psychopathology or mental illness is seen as really just a consequence of mistreatment and not anything like inherent self-centeredness. And so the approach to counseling in those models is often that if you just merely support and encourage wounded people, that's seen as sufficient to help them thrive. Now, before we just wholesale reject that, I do want to just ask the question, why does it seem that humanistic approaches actually help a lot of people recover from the depths of their mental illness? It may not help them move closer to Christ, but why does that help them be healthier? And I don't think just kind of delude themselves to feeling healthier. I mean, people that I've worked with living richly satisfied lives as far as they know that satisfaction can go. Why is that? And I think maybe there's a few thoughts I'd have. One is that Satan does not have the power to create anything, only to corrupt things, which means there's something in all this that isn't just something that's created out of thin air that's wrong. It means he's taken something that is good, that's true, and corrupted it. So what might that be? I think that treating people well is not a non-Christian thing to do. That might awaken their sort of God consciousness, their sense that despite all their woundedness, they're still good in the world. Good in the image of God, in whose image they were made, and in the reality of God about them and in our world, that God is immanently present. And having an experience with someone who treats them kindly and can contain their chaos, you might be the first person someone's ever experienced that with. So of course that's going to be containing for them, and for us as believers, deeply embodied in terms of Christ in us being manifest to them. When I did missions work, it was called incarnational ministry because we lived in urban slums. We, like Christ, this idea of incarnating ourselves among them. John 1:14, the Word became flesh and dwelt among us, and we've seen his glory. Glory is of the only Son from the Father, full of grace and truth. So in other words, even though a humanist therapist doesn't care or want to glorify God, in some ways they are reflecting the image of God in the embodiment of things like love, patience, care for someone. We can do that all the more when we are really tuned in ourselves to our relationship with the Lord and to manifesting his glory, his character of love and patience and mercy and forgiveness and justice. When we're embodying that, that's going to make a difference in someone's life. So let's not just wholesale reject theories of personality that are psychological or even humanistic or that border on becoming their own worldview that's so counter Christianity. Let's look at, well, what can we understand in this that's been corrupted so we can get back to what was actually going on here, that's why there's some helpful things in this. And I want to end with thinking a little bit about some spiritually integrative interventions, some just real practical examples too of things that I'll do with people. You may have heard of mindfulness, and there's lots of different sort of Christian appraisals of what that means. It's largely come from the secular field and even Eastern religion, but when you think about it from a Christian perspective, it actually is something that I think is deeply rooted in Christian history, especially through more contemplative traditions of prayer. So mindfulness is primarily an exercise to help someone be really grounded in the present moment, and it does that by using the senses, paying attention to what you hear, to what you're feeling physically as you sit in the chair, to what you smell, to what you taste, doing that with great attention and letting any other thoughts that are going around, depressive thoughts, anxious thoughts, letting them just be, not trying to get tangled up in a fight against them, but to surrender and to focus on the present moment. Now that could be done in a very secular way, but I think as Christians it makes sense why this works, why this is effective for people. So C.S. Lewis in the Screwtape Letters wrote, "The present is the point at which time touches eternity. Of the present moment, and of it only, humans have an experience analogous to the experience which God has of reality as a whole. In it alone, freedom and actuality are offered them." So in other words, when you can help someone be in the present moment, you are helping them get as close as they can to the experience of eternity and to where God is. God is in the present because he's always in the eternal now. And so much of depression has to do with the past and anguishing over things that were perceived as failure. So much of anxiety has to do with the future and what we're anticipating. If you can help people be grounded in the present moment through a prayerful time of reflection on what you're experiencing now in an embodied way, bringing together all of our mind, our brains, our bodies, our soul into the here and now, that is where people meet God. I also want to talk about the self-esteem trap, because this tends to be where I'll go with people, even who aren't believers, all the time. Because people come to therapy almost with an expectation that they're depressed because they have low self-esteem and that I'm going to help them gain self-esteem. And I don't. And I call that out right away. Because pride can be manifest equally as thinking too highly of oneself, arrogance, or too low of oneself, a false humility. Both focus on comparison to others, which is pride. It's deadly. With the former being a display of our perception of greatness, and the latter being a protest against the lack of recognition of our greatness. Both make a God out of ourselves, and both are sin. I really like Tim Keller's approach, where he says the essence of gospel humility is not thinking more of myself or thinking less of myself. It is thinking of myself less. And I bring that in directly with people, even people who don't know the Lord, to just say, look, either way you go, you're just comparing, and it's never gonna satisfy you. I also love what John Piper has to say, that the purpose of life is not to be made much of, but to make much of God. In other words, we're designed for experiences like the Grand Canyon and the ocean, where we look out and have awe for things that are greater than ourselves. The goal of therapy should not be to make someone think really that they're all it, but rather to liberate their mind and their emotions to think about things and experience things far beyond themselves. And what more is there than the Lord? And often that does mean leading then people to actions of love, looking to others around them, to volunteering, to looking at how they can give and give more in terms of to their family and to their community. And I often recommend church, even to people who aren't Christians. And often they're like, okay, I'll give it a try, Or people have said, yeah, I remember I used to be part of that. And yeah, there's the hypocrites, but also a lot of people are really good to me. Mostly people respond to that really well. Often I encounter existential issues with people. And, I'll tell them frankly, I would be depressed too if I was just a cosmic accident. That's how I'll address people who really have no spiritual beliefs, think that we are just the result of the Big Bang. I'll say, I'd be depressed too. In other words, I don't think there's anything wrong with the fact you're depressed. I think there's something wrong with how you look at the world. People, again, seem to respond pretty well to that. I've never had someone yell at me and get up all angry or not show up again. That tends to draw people in, again, when I've developed a connection and they know I care about them and really sincerely want to help them. Often I call out the shallowness of basing self-worth on things like personal performance, career, even a lot of aspects of relationship that really is not love, but is more about the desire to be loved. I call those things out and say, maybe part of why you're depressed is you're trying to base your self-worth on things that are never going to bring that to you. When I'm working with kids who spend all their time watching Netflix or things like that, being able to say, how valuable are those things? I'll say, well, not very. Say, if you spend all your time on things that are valueless, guess what? You're going to feel valueless. Let's spend our time doing some things that actually are worthwhile, and then you're going to begin to feel some worthiness. A lot of the people I see in Salem are nominal Christians, or the spiritual but not religious. And for those folks, some of the things I often will say is, if any of this God stuff that you believe is actually true, do you see how that changes everything? Just to get people thinking, oh, wait, these beliefs that I hold in such a small part of my life, if those are actually true, that changes everything we're talking about. So I'll just put things out there like that for people. Or I'll say, aren't you alarmed at your lack of feeling or concern about something so massive as God? Just to awaken people like, oh, maybe there's something wrong that I don't care more about something that I say I believe that truly does change everything about the world. Lots of guilt and shame in people's lives. And forgiveness is certainly, even in secular therapy, something that people pursue and talk about. But forgiveness just does not satisfy people without the idea of justice. Leads a lot of people to resentment, bitterness, anger, things like that, because they want to forgive, but they also are right to feel that there should be justice. And really, Christianity is the only reality that actually provides a resolution between those things. And so I just suggest, at least in my work, if it's not a Christian, I just don't rescue them from their discomfort. Sometimes the most helpful thing you can do for someone may be to make them uncomfortable with the holes in their worldview. And finally, I just really do suggest making use of grief. I think that that's an essential part of change for people. And I don't just mean grief in terms of if they've lost someone and they are grieving, but rather people who come and they're depressed, they're anxious. They need to grieve some loss. And grief is a process that God has set up in our lives that is a thing we go through and we move past. When people are stuck in depression, it's because they're not grieving. It's because they're not recognizing needs that have not been met, valid needs that have not been met. And so they protest against that, or we get down about that, but we don't grieve it. And so a big part of therapy is have those tissues handy, because people need to grieve. They need to cry. They need to feel the pain of our separation from God ultimately, and all the destructive outworkings of the loss of that relationship. So recognize and grieve unmet needs, because grief leads to acceptance, which then empowers exploration, including spiritual exploration. That's all that I have for you. I'm really grateful that I could share with you some about my experience. I could be wrong about plenty of this, and so please do your due diligence as you think through these things. And I do pray that some of this will be helpful. And I hope that there might be some opportunities to work some more together. And I put my contact information here if you'd ever like to chat or get together, I guess during the pandemic, over the phone or Zoom primarily, about any of these things or things that you're experiencing in your work with folks. I would love to hear. I'd love to be part of it. I'm just have gratefulness in my heart for Salem Heights and for the work that you're doing, and I feel really grateful that I got to be a part of this. So feel free to contact me, and I'll look forward to hopefully hearing from some of you. And for those of you that I don't, God bless you and all that you're doing.